Welcome to Healthline Channel, where we continue to give various public health education on various common public health conditions. Now today we want to have a look at the differences between type 1 diabetes mellitus and type 2 diabetes mellitus. Now before we proceed, let me take this opportunity to thank all our viewers and all our subscribers, and note that we appreciate your effort. Now to begin, there are several differences between the type 1 and the type 2 diabetes mellitus. So what are these differences? Number one, type 1, of course, is a very rare type of diabetes and accounts for about 10% of all the diabetic cases. And type 2 is very common, and that accounts for 90% of all the diabetic cases. Sometimes it's even more than 90%. Now, type 1 diabetes mellitus is very common within the childhood period, and it can also occur at all ages, but very common within the childhood period. Now, type 2 is then common within the adulthood period, but can also occur at any age. The next difference is that in type 1 diabetes mellitus, there is an autoimmune destruction to the pancreatic cells, so that we have a lack of insulin, or we have interference with insulin production. And in type 2, the body develops resistance to the produced insulin, and therefore impairing the absorption of glucose. The next difference is that type 1 diabetes mellitus is of sudden onset and is very rapid. But in type 2, it's of gradual onset. Gradual means it rises very slowly but very steadily. The next difference is that in type 1, various autoimmune antibodies, or what we call autoantibodies, are present. In type 2, the autoantibodies are absent. It's also important to note that type 1 is very common, or one of the common complication of presentation is the ketoacidosis. When it comes to type 2, the ketoacidosis is very rare. Now, ladies and gentlemen, those are just but a few various differences between the type 1 and the type 2 diabetes mellitus. In our next clip, we'll then be able to talk about the various complications of diabetes mellitus. And this, just as I have said before, is a disease that has been declared of public interest or of public concern. And therefore, it is important to take note of the complications that can occur or that are very common when it comes to diabetes mellitus. If you are watching us for the very first time, kindly subscribe. Until next time, it's goodbye from all of us.